The final screws are in place, and the disinfecting lights are on.
This is so strange.
Most would likely agree. The new normal is
So odd.
as employees head back to work at this business.
Cleaning my hands.
A metal detector-looking sanitizer is part of this office's new workflow.
This is the strangest experience.
They're above and below.
The creator, physicist Fred Maxick, claims it safely uses ultraviolet light to kill bacteria and viruses.
The idea is that you could walk into it, you raise your arms, you turn around, and during that 12 to 20 second period, you are actually deactivating viruses that might be on your skin, on your clothing, in your hair, on your shoes.
But does it really work? And could it even be harmful?
Stand under the portal for just a few seconds.
Ultraviolet light is normally toxic, and multiple UV associations warn against using UV lights on skin as disinfectant. Still, Maxick plans to sell his device to workplaces.
It utilizes a far UVC that's been shown to not be carcinogenic, that's been shown not to damage your eyes, and therefore it's human safe to keep in your environment.
Other scientists say the method is suspect, using light that's too weak to work.
If it's not hurting your eyes, I wonder how strong it is.
Plus, he says, it could give people a false sense of security.
You're not good. You're going to have to keep social distancing. You're going to have to keep washing your hands.
Christian Pinkston says he invested in this technology for his company, hoping it would protect his employees whenever business begins to normalize.
We realized that the typical old way of doing business wasn't going to work anymore, and we needed to innovate.
You stop, you raise your arms,
Pinkston's investment, one of many. Maxick says during the pandemic, orders have taken off.
It has gone from units we would sell a few dozen of during the course of a year to units we're selling a few dozen of almost on the hour.
Whenever the masses head back to work,
we can know that we're coming in or going out of the office and being clean.
Technology adding some reassurance, but by no means eliminating the threat of coronavirus from employees.
You can sterilize the outside of them, but if they're shedding virus and they're breathing and talking while they're at work, they're going to bring it in right past that UV curtain that they walk through on their way into the office.
Feel like I'm ready to go. I'm a new man.
Contact tracing is part detective work, part widely used public health method, and experts believe a key strategy in fighting the coronavirus pandemic. It relies on identifying and interviewing every person who tests positive, isolating them, and then finding anyone else that person could have infected. These people may then be quarantined before they can spread the infection to others. A recent study estimates that because one person infected with COVID-19 can infect 2 to 3 other people, just one positive case can turn into more than 59,000 cases after 10 rounds of infection. Contact tracing can help prevent this potential wave of infections from becoming a tsunami. It's a tedious approach, but one that is widely credited with stopping SARS in 2004. After that outbreak infected more than 8,000 people around the world and killed nearly 800. Public health officials say contact tracing is a necessary step before certain businesses can reopen and people can start to return to normal activities. Some countries, including South Korea, India, and Singapore, are using smartphone technology alongside traditional techniques to ramp up their contact tracing programs. While the CDC in the US has started a pilot program to ramp up contact tracing in some states, many studies estimate that the US will need hundreds of thousands of additional public health workers before a contact tracing system can really begin nationwide.
COVID-19 is known to attack a person's lungs, and one of our best defenses against that is to make sure they're strong and healthy in the first place. And for many, that starts by stopping smoking. While scarring to your lungs can't be reversed, the U.S. Centers for Disease Control and Prevention say there are several short-term benefits when you quit smoking. One of the first things to heal is the cilia in your lungs. These are hair-like projections that wave back and forth as air moves in and out of your lungs. According to the CDC, the cilia help fight off infection and also help clear mucus out of your lungs. coughing also helps activate the process in the lungs to clear out mucus, especially important when dealing with novel coronavirus. When you quit smoking, you are also helping to reduce the inflammation on your lungs, allowing you to take deeper breaths and not get as easily winded. Though it may take several months for your lungs to clear out all the gunk from smoking, it's a change you'll be glad you made right now.
Dr. Jha, the president said tonight that testing is, his words, skyrocketing. He talked about 200,000 tests done on Saturday. He says that's double the daily number from a month ago. Obviously, a week or so ago, you were very concerned about a stall, but we have seen an improvement. Is this a skyrocket? Would you agree with that?
Yeah, so thanks so much for having me on. Look, we've been woefully behind this entire time. And I think what most Americans need to know is the reason we are shut down, our economy is such a shutdown, is because we've had inadequate testing. And we've been stalled at 150,000 a day. 200,000 is not a skyrocket, it's an improvement. We believe we need to be in at least 500,000 tests a day. And most people criticize us for being too low. Other people think it's a lot more than that. So it's like mild progress in the context of when you're starting off really far behind. If you ask the question, where do our numbers come from? What we're trying to do is come up with a very basic estimate of if you walk into a bar or a diner, you want to make sure the guy serving you coffee isn't infected shedding virus. That's what we're trying to create. Like, how do we create a society where people feel comfortable going back outside? And you need at least 500,000 tests, but probably a lot more if you're going to create confidence for people to engage in basic economic activity. I don't understand why the White House is lowballing this. This is the thing that is central to getting their economy open, getting our economy open. You would think everybody at the White House would be focused on this 24/7. They keep lowballing it. I don't get it. It's fundamental to getting our lives back.